So I do recommend homemade veterinary diets for certain patients. I also believe that home-cooked diets, when formulated and prepared appropriately, can provide complete and balanced nutrition long-term to veterinary patients, and it's something that I use very frequently in my practice. Some of the disease processes that I use home-cooked diets for include things like kidney disease, especially when these animals have a very poor selective appetite for a lot of the commercial products that are available, which does happen. A lot of times I'll use the homemade diets with gastrointestinal disease. I'll also use them in patients with diabetes that, again, maybe have a poor selective appetite for commercial foods, and it's really important to be able to get these animals to eat well twice a day so they can get their insulin. So there are a lot of disease processes where this can become really, really useful in terms of our management. In particular, I like using homemade diets when there are concurrent disease processes, when there's not a good commercial diet option available. So kind of the classic example that I think about are animals that have kidney disease, but they also need a low-fat diet because they've had issues with pancreatitis or hyperlipidemia. So I can make a diet that's actually customized to that patient and ensure that it's complete and balanced to meet those patient needs. But in turn, I then need the pet owner. Their quality control comes into play in the actual production of that diet. So I often tell them I'm the formulator and they are the manufacturer. And so there's quality controls on both of our sides to make sure this diet is appropriate long term.